Some much needed relief for healthcare providers across the country. The Biden administration sending an additional $2 billion to help hospitals and medical service providers fight the latest COVID surge. NBC News reporting the Department of Health and Human Services announced the latest funding as healthcare groups emphasized how the coronavirus had overwhelmed hospitals. NBC News healthcare reporter Phil McCausland joins me now. Phil, thanks for being on. This money is coming from the Provider Relief Fund. Tell us about that fund and where specifically that $2 billion is going.
Yeah, the Provider Relief Fund was created in the CARES Act, which was that huge first sum of money that Congress allocated back in March 2020. They put aside almost $180 billion. And during the pandemic, they've slowly been releasing that funding for hospitals and medical care providers to have access. Because, I mean, hospitals and medical providers, they're really struggling through all this, right? I mean, as hospitals are really overwhelmed, they're having to, not do those elective surgeries, which is really a lot of where hospitals get some money from to keep the doors open and the lights on. So this money is supposed to help kind of recoup those expenses, keep the hospitals working, and help them make their way through the pandemic.
So what are the hospitals saying? Is that enough? Does it make a dent here, or do they need way more?
Oh, yeah, the hospital association's definitely saying they want more through all this. I think, the big thing to remember is $180 billion is a huge sum of money, right? But Congress has been releasing this in waves, or I should say the administration has been releasing this in waves. So this is the latest phase of funding, this $2 billion. But the Hospital Association is saying, hey, we want the remaining dollars in that account. We want to extend the deadline to use it. We want to expand the criteria of spending. And they want more money in it. They want another $25 billion. As well as pushing some cuts to Medicare rates that they get as well. So, after the Delta and Omicron waves, which we've really seen hospitals overwhelmed, I think they're saying, hey, a challenging time continues to be challenging.
So let's talk about the challenges here. It almost seems like a chicken and an egg question. I know that's not exactly the right analogy, but is this a staffing issue? Is this a resource issue? Or at this point, it's just all of those things combined?
It's a little bit of an all of the above, I think. Yeah. When you talk to hospitals, I think resourcing has gotten a bit better, right? Those big mask shortages that we saw at the start of the pandemic, a lot of that has been resolved. And I would say some of this has moved further along, although we've seen shortages of things like crutches and oxygen along the way. But staffing shortages, I think, is the big one and continues to be the big issue. We're seeing, a real drop in staffing for nurses, even for doctors, and the cost of getting nurses onto the floor is just continuing to rise.
Yeah, it's unbelievable what they're dealing with, the staffing struggles that they're going through still. Phil, thanks so much for being with us.
Thanks for having me.
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.